Hi, everybody. I'm Dr. Alamanda. I'm one of the hip and knee replacement specialists at OrthoVirginia. I'm primarily out at our Reston office, but I also go to our Herndon office. And first of all, thank you all for coming today. I think it's a very important topic that a lot of patients ask me about, particularly on how to maximize their recovery and get the most out of their hip or knee replacement. So I figured I would share a PowerPoint with some highlights, and then really I want this to be an interactive session. Feel free to ask me questions, and we can sort of take it from there. So Margaret, by the way, is our social media ambassador, and Yvette was here with me today. Done a fantastic job sort of helping me put this together. So one of the most important things that I tell patients is ice. Ice helps significantly with postoperative recovery. We found this to be particularly true with knees. We found this to be true with hips. Ice helps with swelling. And in fact, some large-scale studies have shown that ice is actually a better pain reliever than narcotic pain medications. It helps sort of prevent swelling from becoming too much. People often ask about what kind of machine should I get? Should I get one that compresses? Should I get a fancy machine? I tell them ice, in whatever way you can get it to the wound, is the best way to do it. If you want to get a machine, go for it. Bags of peas. Frozen bags of peas work just as well. The only thing I would tell patients is make sure you put some sort of protective barrier between the actual wound itself and the ice. So maybe like a pillowcase or some sort of clothing in between. I also, tell patients that while ice is a very important thing, some patients make the mistake of waiting a little bit too long before they start the ice. So in fact, for our hip and knee replacement patients, we start putting ice on post-op day 0. So as soon as they come out of the recovery room, ice is on there, and we're working on swelling control from the beginning. Another important thing that I found that really helps with recovery after a total joint replacement is motion. Particularly with knees, we know that preoperative range of motion is the best predictor of postoperative motion. So if patients want a great outcome after their knee replacement surgery, I tell them some of the most important things, you can start doing them before surgery. So work on bending the knee as much as you can before surgery, work on getting it fully straight, work on trying to get the bend back as much as you can. Now, sometimes it may not always be possible after your surgery because of the swelling and everything, but the more you can do before, the more it's going to help you after as well. And when it comes for hip replacement, the same thing. I tell patients that, build up your muscle mass. It's one of the most common analogies that I make in my clinic is that getting a joint replacement is like getting a brand new set of wheels. If the engine is not good enough to drive those wheels, that car is not going to go anywhere. So the muscles are the biggest drivers of the outcome. So, for the knee, it's going to be your quad and hamstrings. For the hip, it's going to be your hip flexors and your abductors. So getting them strong and conditioned is going to come a great deal for postoperative recovery. Patients also ask about pain management. Knee replacement, hip replacements are big surgeries. So we want to be on top of the pain. And I tell patients that, it's okay to combine certain medications. Ice should be your first line to get the swelling control. But then people often don't realize that you can combine Tylenol and anti-inflammatories like meloxicam, Celebrex, ibuprofen. So you can combine Tylenol and an anti-inflammatory of your choice together. They work synergistically much, much better than either one of them separately. And they can really, really help with getting the pain and inflammation under control. They work by different pathways. So the Tylenol is an analgesic. It helps to modulate the pain receptors in the brain to decrease the pain signal. The NSAIDs like ibuprofen, meloxicam, they work by decreasing the inflammation at the source. So you hit it from multiple fronts. You hit the heights with local swelling, you have the NSAIDs to help with the inflammation, and then you have the Tylenol to decrease the signals in the brain to get the pain under control. I also tell patients supportive health plays a big role. Distractions are key. Make sure your room is comfortable, especially in the middle of the night. If it gets too cold or something like that, then you can suddenly jerk and then pain is going to start. So make sure you sort of keep those things in your mind. Have some sort of distractions already planned for after surgery, be it reading a book, watching some of your favorite TV shows. But the most important thing doing all those things is moving. Take a break every 30 minutes. Get the joints moving. That helps with circulation, that helps with swelling, that helps with motion. It also helps to prevent blood clots from forming. So all those things are going to be key in helping you recover and having a good outcome after a joint replacement. The other thing that a lot of people sort of overlook is GI health. I make a big deal out of this because a lot of the stuff that we do during, before, and after surgery can sort of cause difficulties with the GI system. A lot of the pain medications we give patients can cause constipation. So it's very important that patients are on top of those things, taking a gentle stool softener to sort of help, you don't want to, last thing you want to do is strain after a hip or a knee replacement. And hydration becomes an even more important topic, right? Hydration helps with preventing constipation. It helps with sort of making sure you're well hydrated. You're going to be anemic after surgery. So we want to make sure that the body has all the resources that it needs to have a good recovery. Right after surgery, patients are also going to be a little bit nauseated because of the anesthetic, because of not having anything to eat or drink for the before surgery. So it's going to be important that we stay on top of it. Anti-nausea medications. We send patients home on some anti-nausea medications to sort of suppress that if that becomes an issue. But sometimes it's good to be proactive. So things that have ginger in them, for example, ginger ale can help decrease the nausea and make sure you're sort of having a good, healthy diet, right? Making sure you're taking a lot of protein to help with recovery of those muscles and bones and things of that nature after surgery. The other important thing that I sort of say is, you just went through a big surgery with a hip or a knee replacement, so be careful. We want that to be the only surgery. I tell patients it's a marathon, not a sprint. So don't be bashful. It's okay to use walking aids for that first week, be it a cane or a walker. For those first few days after surgery, it's a safety net, if anything, right? You're not relying on them to support you. The implants can support whatever, the bones and everything, but it's a good safety net, prevents you from falling, or at least decreases the incidence of that from happening. The last thing we want is a periprosthetic fracture or the wound opening up or something like that after a fall. Speaking of wound, incision care is also very helpful. We put waterproof dressings on our incisions, so that allows you to take showers from post-operative day one. I think it's very important that overall hygiene is well maintained. You can still dab the wound, dab the dressings to make sure it's dry, and then you can peel off the dressing in about a week or so. I still tell patients until about 4, 5, 6 weeks after surgery, you want to avoid submerging the wound because there could be tiny openings that you don't want water or other pollutants or bacteria to get in and potentially cause an infection. But we want the wound to be nice, dry. I always tell patients to not put any sort of, in the beginning at least, avoid applying anything on the wound. Don't apply, Voltaren gel, don't apply Neosporin. The wound does not like any of those. It likes to be nice, dry, and that allows it to heal from the inside out in a very sort of safe and efficient fashion. So those are some of the top tips that I had in my mind that I thought would be very helpful to kind of share. But like I said in the beginning, I really want this to be a very live and sort of engaging session. Feel free to type your questions on Facebook. I know Margaret is moderating the session, and I'll be happy to answer as many as we get through today.
Thank you so much. We do have some questions coming in. So one of them is, how does physical therapy fit into this?
Yeah, physical therapy plays a big role, especially for knee replacements. The name of the game after a knee replacement is motion, motion, motion. We're trying to get the knee to bend back as much as you can. And it's a very interesting thing because right after surgery, your knee is going to be angry. It doesn't want to move. It's going to be painful. So the thought is that you don't want to move it because you want the pain to be better, right? But those initial weeks or days after surgery are some of the most important pivotal time to get the motion back. So I always tell patients, don't be bashful, take the pain medicines and work on bending the knee as much as you can, work on getting the muscle strong. And pre-ab plays an important role as well. So a lot of the things like building the muscle up, you can do that before surgery itself to sort of, again, optimize the recovery and make sure you have a good outcome. With hip replacements, we don't require physical therapy anymore. Activities of daily living essentially serve as physical therapy. Just because we don't require it doesn't mean we're opposed to it. So if you feel that, hey, you know what, I could benefit some physical therapy from focused one-on-one sessions, by all means, we're fully supportive of that. And I think, encouraging the muscles to become strong before surgery with a hip replacement is going to be equally important as well.
Thank you. Would a TENS unit help with pain?
That's a good question. The literature is mixed with respect to a TENS unit. My personal philosophy is that if you have the resources, and it can't hurt, but I cannot guarantee or say that I cannot say that go buy a unit right away, because it's going to make a big difference. But I'm not, like I said, I'm not opposed to it. I don't think there's any significant downsides to using a TENS unit. I know a lot of there's been good literature in the trauma patient population about sort of having good results from that. But if it helps, go for it.
Thank you. How soon can patients go upstairs after surgery?
That's a very good question, and one that I commonly get. It's Northern Virginia, and everybody has a staircase in their house, for better or worse. It's for me, after total joint replacement, after hip or knee replacement, you can go up and down steps on post-op day 0. So the same day of surgery, you're able to go up and down steps. In fact, if you're going home from the hospital, that is one of the criteria that the physical therapist has to clear you before they'll let you get out of the hospital or the surgery center, depending on where we do it. We want you to be safe and sort of in going up and down. I always tell patients what used to take you maybe a minute might now take you 5 minutes. So yes, you can go up and down. The other thing I tell patients is limit the number of times you go up and down. So let's say your bathroom and your bedroom is on the 2nd floor and the living room is on the 1st floor. Go to the bed at the end of the night, sleep in your own bed where you're comfortable, go up the steps, sleep the night, do all the stuff, in the bathroom and everything in the morning, take a shower, and then come down and then just stay in the 1st floor for the majority of the day. Just because you can doesn't mean you should. So if you keep going up and down the steps multiple times, what's going to happen is your muscles are going to get fatigued, and that's just going to lead to increased pain, poor pain control, and have a potentially more difficult time with therapy and things of that nature.
Thank you. What can someone do before surgery to help increase their chances of full recovery after surgery?
Yeah, I think one of the most, as I've alluded to before, one of the most important things that you can do is strengthening your muscles and working on your motion, right? So that's the actual thing. So let's say you're signed up for surgery. I would work on, for a knee replacement, making sure you're able to bend the knee as much as you can before surgery. Make sure you're able to strengthen your muscles before surgery, and likewise for the hip replacements as well. Before your replacement surgery, make sure you work on strengthening your abductors, your hip flexors, and things of that nature. Another sort of tangent to this is medical optimization. We talk about physical optimization, but medical optimization plays a big role as well. Let's say you have an arthritic knee or an arthritic hip, and you're thinking about a knee or hip replacement. I think one of the things you can do, sort of being proactive about it, is to take some steps way before even the planned surgery to get yourself the best outcome possible after surgery. What does that mean? So let's say you're diabetic, make sure your blood A1C levels are under good control. Make sure your blood, your medications are optimized. If you have hypertension, check with your primary care doctor, get those numbers low and well maintained. If you're overweight, reducing the weight helps significantly, not only on arthritic knees and hips, but after recovery as well, for post-op recovery. So all those things can help. If you have any dental issues, if you have a chronic infection in your tooth or something, that might be a time to sort of get it all sorted out before surgery. All these things can help avoid roadblocks down the road and sort of prevent any mishaps or anything like that from happening, and ensure you get the best possible outcome.
Thank you. Do you have suggestions of specific exercises for patients to do before their surgery?
Yeah, so one good resource that I'd like for you guys to go to is the American Academy of Orthopedic Surgeons. So it's called AAOS, so AAOS.org, and it is the national organization for orthopedics in general. And if you go under patient instructions, there's a bunch of exercises for every body part. So for hips, for knees, unrelated to hip and knee arthroplasty, like spine, foot and ankle. Those are great beginner exercises that they have. They're very simple. They got pictures on them. It tells you how many reps to do, how many sets to do. And in fact, patients who come to my clinic, I give a copy of it to them to help with recovery and sort of, optimizing their chance of success as well. The other resource that I want to sort of bring your attention to is another website called AAHKS. So it's the American Academy of Hip and Knee Surgeons. Now, this is specifically focused on hip and knee stuff. And there are specific exercises for hip and knee replacements, what things to do before, what things to do after. There's videos on them. They've got wide variety of exercises for specific ailments. So arthritis issues, IT band issues, stroke bursitis issues. So things peripherally, but also connected to hip and knee at the same time. I think that's a great resource. Patients love it. It's very detailed, but not too sort of too in-depth, and easy in-home exercises that you can do by yourself without the need for a therapist or anything like that.
Thank you. Someone asks, how do you know what the right amount of motion is? Not too much and not too little.
Right. So I think, use your body as a guide. I think, especially with knees, and I think this is what the question pertains to. Your therapist is very, very helpful in answering that. So I think postoperative recovery goes hand in hand with postoperative physical therapy after a knee replacement. So you're gonna be working with the therapist. I tell patients, ideally at the 2-week visit when I see them after a knee replacement, I want them to be at least to 90 degrees. So the knee should be as close to fully being straight and to be at least to 90 degrees. That's going to help with, making sure you're on a good path to sort of working on getting the motion you need. Because as I tell all my patients, at the end of the surgery, we know your knee can go fully straight and we know your knee can bend fully back. So we know it's there. So we just have to unlock that potential. And I think that happens with you working with therapists and things of that nature. And sometimes you may be discouraged where, it's week 2, week 3, you've made good progress, but all of a sudden now you're just tired, the knee doesn't want to move. And I've seen a couple of patients where they try to push through it, and then that can actually be counterproductive, because then the muscles are tired, fatigued, and it becomes even more difficult to sort of get the motion back. So in those cases, I sort of recommend take a break and then sort of regroup and then go back. And I think that's where the personalized sort of plan with the therapist comes in, really, really helpful. That way they can work hand in hand with you and sort of making sure that we get the best outcome possible.
Thank you. So if somebody is looking to increase the amount of bend in their knee after surgery, working with a physical therapist would be a good thing to do.
Yeah, definitely. I think the physical therapist is great because they can help point out things you're doing right or point out things you're doing wrong. They can tell you specifically what things to do that you would not even have thought about to help get the bend back. We, in fact, as a little anecdote, we used to use things called continuous passive machines, or CPMs. These were machines that would bend the knee for you in a passive fashion. That was sort of actually the mainstay of treatment for knee replacements, about a decade ago or so. But we don't really use them anymore because what we found is that passive motion, while the machine bends, the knee might not be bending. So I think that's where the therapist comes in very helpful. They can actually measure it. They can actually look at the knee. They can actually see what you're doing right, what you're doing wrong, what's impairing your motion. Is it the swelling? Is it the lack of quad function? And can fine tune a plan to get the most out of the replacement.
Thank you. Would swimming or water aerobics be a good exercise after a hip or knee replacement?
Those are my go-to exercises, but you got to be careful because you don't want to get in the pool, again, going back to my point about not submerging the wound. So until you get the okay from your surgeon that it's okay to get the wound immersed, I would probably stay off any sort of water activities, but swimming is terrific. It takes the effect of gravity away. So your weight is not so much on the joint, but it still has a very comprehensive workout of all the muscle groups and sort of gets your motion going, especially with the knee and with the hip as well. It just loosens things, prevents things from becoming stiff, and it's good aerobic exercise. It just gives you good cardiovascular benefits as well. So, I love those kinds of exercises. And speaking along the topic of exercises, even before surgery, I think swimming is a great activity to do. The more you sort of do that, the more, again, it's going to give you the benefits of strengthening your muscle, getting your motion. You want to focus on activities like elliptical, right? Those are things where you're not jumping, you're not pounding on the knees. That avoids sort of that increased pressure in the knees. In general, I also tell patients with arthritis to avoid squats and lunges. They put significant amount of pressure on the knee and can sometimes flare up the arthritis and make it worse. So be careful of certain exercises that you should probably stay away from. But swimming is fantastic to do.
Thank you. A couple of people have commented that they are unable to take NSAIDs for whatever reason. Are there alternative options for pain control?
Yeah, it's unfortunate. NSAIDs are one of the mainstays of treatment, but as you said, if patients are on blood thinners like Eliquis or Xarelto, oftentimes, or GI upsets or GI issues, we can't sort of give NSAIDs. But it's helpful for us to know what exactly the interactions is. Obviously, if you're on powerful blood thinners, that's a strict no-no. But if it's if it's a mild gastritis, there's things we can do to sort of help modulate that. We can give you a lower dose version. We can put you on a PPI to sort of mitigate the effects of that. But barring that, then ice becomes even more important role. Tylenol becomes an even more important role. We give you steroids, low dose steroids around the time of surgery to help with mitigating some of the nausea, some of the pain, acute pain. And then we sort of step into the world of narcotics, right? We start with the very low dose narcotics and then slowly bump it up if we need it. But again, narcotics are not benign. They have their own host of issues, right? They sort of cause constipation, amongst other things, and sort of with the opioid epidemic, we sort of want to make sure we're not using them too much, but at the same time be mindful and get good pain control so that we sort of optimize recovery after total joint replacement.
Thank you. What is the best way to cover the wound when taking a shower?
So most of the time, it depends. It depends on the kind of surgery that was done and what they do. But for in general, for example, for our patients, we use the knee is closed and the hip is closed in layers. So we use absorbable stitches, and then we put a skin glue on. That's the first line of defense. The skin glue essentially makes it completely waterproof. And then what we do after that is we put a waterproof dressing on top of the skin glue itself. So that adds a second layer of protection. So when patients go home, they're able to take a shower with that waterproof bandage on that stays on them for about 10 days or so. And then after about 10 days, what happens is they just peel off the bandage like you would any other Band-Aid and just leave the wound open to air. The skin glue underneath provides that secondary defense, and you still take showers as normal. The only thing I would say is when you're taking showers, what you want to do is you want to just let water and soap run over the wound. You don't want to actually scrub anything in the wound, and just pat it dry afterwards and sort of dress normal, but I wouldn't cover it up all the time or anything like that. Covering it up all the time is actually not a good idea after you take out that initial dressing, because covering it all the time can trap moisture and can cause secondary issues from happening. So,
thank you. Are there restrictions on dental procedures around the time of your replacement?
Yeah, so that's a good question. I usually don't like to have patients undergo dental procedures unless it's an emergency for about 3 months after a hip replacement or a knee replacement. And then usually if you're gonna have any work done, dental work done, you wanna try to do it well in advance before your surgery. But at least a minimum of 2 to 3 weeks between your whatever procedure you've done and your surgery itself. The reason why we're sort of so focused on this topic is that anytime you do a hip or a knee replacement, is that joint becomes very, very vascular. So there is a lot of blood flow going to that area, which is what causes the swelling and things of that nature. So what happens is whenever dental work or anything invasive is done, there's a small chance that you could have a potential bacteria or something